Hello, welcome to my channel Magic of Medicine. Today's topic is regarding the pituitary gland. Pituitary gland is the main endocrine system located in the skull in concavity within the sphenoid bone, which is known as sella turcica. It is situated immediately below the hypothalamus. It has two parts: the anterior pituitary, which is called adenohypophysis, and posterior pituitary, which is called neurohypophysis. Anterior pituitary is divided further microscopically into three parts: pars distalis, pars tuberalis, and pars intermedia. Now, studying about these one by one. The anterior hypophysis is 5 times larger than the posterior lobe or posterior hypophysis. It is 80% of total gland volume. Now, what are the differences between anterior hypophysis and posterior hypophysis? First is their development. Anterior hypophysis is developed from Rathke's pouch in the roof of primitive mouth, while posterior hypophysis develops from diencephalon. Second difference is anterior lobe produces hormone in response to release factors carried from hypothalamus by hypophyseal portal veins, while posterior hypophysis releases in response to the nerve fibers whose cell bodies lie in hypothalamus and release hormone in response to impulses from these nerves. So these are the two major differences. Further differences are in their imaging appearances, which we will read in the imaging section. And third thing is the infundibulum. Infundibulum arises from tuber cinereum in the floor of third ventricle and connects with the pituitary gland. It arises from tuber cinereum and then goes antero-inferiorly to attach to the main pituitary gland. So, while seeing infundibulum, you have to keep two things in your mind. First, its location. Second, its direction. And third, its size. It should be tapering downwards. Now coming to the relations. So, above the pituitary gland is diaphragma sellae. It is dura mater. Above this diaphragma sellae is the suprasellar cistern, which contains optic chiasma anteriorly and circle of Willis. Below the pituitary is the body of sphenoid and the sphenoid sinus within it. Laterally, the dura and cavernous sinus with the contents. Now coming to the blood supply. So, as we know, pituitary is called hypophysis. So, it is supplied by two named arteries, superior hypophyseal artery and inferior hypophyseal artery. Superior one arises from internal carotid artery immediately after it pierces the dura. It supplies the hypothalamus, the infundibulum, and in infundibulum it gives a capillary bed, which gives rise to the portal vessels to the anterior lobe. I have already spoken about the role of portal vessels. It helps in hormone release. It gives the signal to adenohypophysis, anterior adenohypophysis, to release the hormones. So it is important. Second, inferior hypophyseal artery. It arises from ICA in cavernous sinus. It was arising from ICA after it pierced the dura, and it is arising within the cavernous sinus, and inferior one supplies the posterior lobe. Now coming to the venous drainage. Venous drainage will obviously in the sinus, which is closest to the pituitary gland, and we know that cavernous sinus lies just lateral to the pituitary gland, so venous drainage will obviously happen within the cavernous sinuses. Now coming to the imaging appearance. So in imaging, The most useful investigation is magnetic resonance imaging, and in MRI also the sagittal and coronal images are most useful ones. So what you have to look in MRI? So follow this format. First, look at the size of the pituitary. Follow the ELSTER'S rule, which I will tell you in a while. Follow the ELSTER'S rule for the size of pituitary. For infundibulum, remember that it should be less than 3 mm, or if you don't want to measure, compare it with the adjacent basilar artery. It should be less than the diameter of the adjacent basilar artery. Then look for the shape of the pituitary. So look at the diaphragm celli. It should be horizontal. It should not be convex. If it is bulging convexly outside, it means there is some mass lying in the sella. However, it can have a convex upper border in menstruating, lactating females, pubertal males or females, because in these conditions, pituitary is hyperactive. It is increasing in size in these conditions to fulfill the requirements of the body. Now coming to the appearance. So we know that T1 images are best to assess the anatomy of any structure. So on T1, anterior pituitary is iso-intense to cerebral white matter, while posterior pituitary is hyper-intense on unenhanced T1 image. Why it is hyper-intense? Because it has stored neurosecretory granules within it, which leads to increased T1 signals. So the examiner can ask you, why does posterior pituitary appear hyperintense on T1 images? So you have to answer, it is because of the effect of the stored neurosecretory granules. So from this image, take the screenshot. It is the most important one. The size, the ELSTER rule, the infundibulum size, and if not, you are not willing to measure, or if you are in a hurry, just compare it with the adjacent basilar artery, then shape, then appearance. Now I will tell you about the anatomy. So coming to the anatomy, look, this one is the anterior pituitary, which is forming approximately 80% of the volume, and this posterior one is the posterior pituitary, and this tapering thing, which I have labeled from purple color, is the infundibulum, and then infundibulum further ends in tuberous cinereum posteriorly, and anteriorly there lies the optic chiasma, and this one is mammillary body. So again, looking in this image, this is anterior pituitary, this is posterior pituitary, this one is infundibulum, this one is optic chiasma, this is tuberous cinereum, and this one is mammillary body. Again, anterior pituitary, posterior pituitary, this tapering anteroinferiorly is infundibulum, this is optic chiasma, this is tuberous cinereum, and this is mammillary body. Now coming to the coronal sections. In coronal sections, this is pituitary, this is infundibulum, and this one is optic chiasma. Now in this side image, I will again tell you the optic chiasma, the infundibulum, and the pituitary. These are the cavernous ICAs lying lateral to the pituitary, and note this is hypothalamus. How do you determine the hypothalamus? It is a midline structure lying on either side of the third ventricle. This one is the third ventricle, and these things are hypothalamus. So in this coronal image, you can assess all of these midline structures very well. Now coming to the most famous ELSTER'S rule. So this rule is regarding the size of the pituitary gland. So pituitary, see, P is written like this. This is P. So which figure it resembles? It resembles 6. So we will begin with 6. Beginning with 6, infant and children will have pituitary measuring up to 6 mm. Then with each plus 2 plus 2 plus 2. Then comes men and postmenopausal females, which will have pituitary up to 8 mm. Then reproductive age women, which will have up to 10 mm. And then late pregnancy and postpartum, which will have 12 mm. So this is the ELSTER'S rule, which defines the size of pituitary and makes it easy for us to remember the size of pituitary and when to call it normal and when to call it abnormal. So a size of 10 mm is abnormal in children and men and postmenopausal female, while it is normal if it is seen in reproductive age women, because the size of pituitary increases in reproductive age women, late pregnancy, postpartum, lactation, because there are increasing body requirements. So this is important. So I have also told you the mnemonic P for pituitary and P for 6. So begin with 6 and then plus 2 plus 2. So this is ELSTER'S rule. Thank you for watching the video. If you found the video useful, please like, share and subscribe.